in support of his amendment.
Thank you, Mr. Chairman. Mr. Chairman, this amendment makes 3 simple changes to the underlying legislation that was reported out of subcommittee. This amendment extends the deadline for CMS to conduct the study to 1 year. It includes the term prodrug as an example of ADFs, and it includes list price as a potential barrier to accessing ADFs. Each year, approximately 4.5 million Americans use prescription pain medications for non-medical purposes, contributing to 89 deaths per day. Of those that misuse prescription pain relievers, 53% reported obtaining them from friends or relatives. Although past legislative efforts have encouraged innovation in prescription drug regulation, law enforcement, and education, there are still individuals who have severe, legitimate chronic pain and need access to opioids. Abuse deterrent formulations, or ADFs, represent a breakthrough technology for these individuals that helps prevent the crushing, snorting, and injection of painkillers. Currently, many prescription drug plans present barriers to ADFs, including cost-sharing tiers, fail-first requirements, prior authorization requirements, and list price, all limiting patient access to abuse deterrent formulations. Instead of receiving ADFs, many patients are limited to using opioids that can be easily crushed, snorted, and injections. Solutions to this public health crisis must balance the need to preserve access to effective pain medications for legitimate patients living with pain while minimizing the risk of opioid misuse and abuse that occurs in our communities. ADFs should be an integral component of a comprehensive prescription opioid misuse, abuse, and diversion prevention strategy designed to limit harm for patients, abusers, and the surrounding community. I'm proud to introduce this with my colleague across the aisle, Representative Loebsack, and my Ways and Means colleague, Representative Reed, and I urge your support. Now yield back.